So today we will be starting from the first chapter, that is metabolic response to injury. So we will study about the first chapter from book Bailey and Love, and first chapter is metabolic response to injury. Introduction. Surgery and trauma cause unavoidable tissue injury. Due to surgery or trauma, there is unavoidable tissue injury. The body reacts with a systemic stress response. After surgery or trauma, it causes tissue injury. After that, body react with systemic stress response. It involves hormones, cytokines. Cytokines are inflammation related proteins. So cytokines are basically proteins, and these proteins are related to inflammation, neural circuits. This leads to change in metabolism, wound healing, immunity, and organ function. While protected, these responses can also cause complications like sepsis and multiple organ dysfunction syndromes or more. Key point: understanding the metabolic response is essential for better recovery and survival after surgery or trauma. So key point over here is understanding the metabolic response is very important because it is essential for better recovery and survival after surgery or after trauma. Homeostasis. What is homeostasis? Homeostasis, it is maintaining stable internal environment for cells to function. Cells maintain their constant internal environment very stable for proper function. So this process is called homeostasis. Injury disrupts homeostasis. What it does, it disrupts homeostasis, and internal stable environment of the cell is disrupted. Then it leads to organ dysfunction. There are two phases of metabolic response. One is catabolic phase, that is also known as breakdown phase, and second is anabolic phase. This is also called as repair phase. Catabolic phase, it starts immediately after injury or trauma. Features of catabolic phase are shock, hypovolemia, low metabolism, reduced cardiac output, hypothermia, and lactic acidosis. Purpose of catabolic phase or breakdown phase is it conserves energy and fluid for survival. Effects of catabolic phase. Effects are muscle breakdown, weight loss, hyperglycemia. That leads to risk of sepsis. What is sepsis? Sepsis is response of body against infection. Second is anabolic phase, or it is also known as a repair phase. It follows catabolism. So after catabolism, anabolism or repair process take place. Focus: tissue healing and rebuilding. It heals tissue and rebuilds tissue. Anabolic phase can last for weeks after major injury. After major injury or trauma, this anabolic phase can last for weeks and it repair and heal tissues after injury. Modern surgical care. Modern surgical care goal. Its goal is support recovery while minimizing stress response. Critical care. Critical care resuscitation, organ support. It helps to restore homeostasis. Complications of modern surgical care: muscle loss, sepsis, MODS. So these are complications of modern surgical care. It causes muscle loss, sepsis. What is sepsis? Sepsis is response of body against infection. And MODS. What is MODS? It is multiple organ dysfunction syndrome, or in this case multiple organs stop functioning properly. enhanced recovery after surgery, or ERAS. What is ERAS? It aims to reduce stress by minimally invasive surgery and stress-free perioperative care. So what is ERAS? It is enhanced recovery after surgery. So main function of ERAS is it's reduce surgery. It reduce stress by minimally invasive surgery and stress-free perioperative care. So these are two aims of enhanced recovery after surgery, or ERAS. Mediators of the metabolic response: a tissue damage and inflammation. So injury releases DAMPs. After injury, DAMPs are released. What are DAMPs? These are not DAMPs. These are DAMPs. DAMPs are damage associated molecular patterns. Damage associated molecular patterns. DAMPs. These DAMPs activate PRRs. What are PRRs? PRRs are pattern recognition receptors on the immune cells. After that, this triggers inflammasomes. Inflammasomes are proteins in the inflammasomes are present in the immune cells. So they activate enzymes or caspases. What it does? These activated enzymes or caspases, these release cytokines. There are three kinds of cytokines. One is IL-1, IL-6, and TNF-alpha. So it leads to systemic inflammatory response syndrome, or SIRS. Effects of SIRS are capillary leakage, coagulopathy, and immune suppression. So these are three effects. Then it risk of organ failure is increased, especially kidneys, lungs, and brain. So these are three risks of organ failure. Magnitude of injury response. So graded response, it is more severe injury. More severe injury causes stronger metabolic changes, and minor surgery, it causes mild changes like fever, increased heart rate. So these are magnitude of injury response. Major trauma, sepsis, burn leads to severe SIRS or systemic inflammatory response syndrome, hypermetabolism, and MODS, multiple organ dysfunction syndrome. Genetic variability affects individual responses. Secondary triggers are sepsis. What is sepsis? It is response of body against the infection. Hemorrhage is loss of blood. Massive transfusion. Sometime after injury or trauma, patient is transfused with a lot of cell products or blood cells. So it is a secondary trigger. Acidosis, surgery, crush syndrome. And crush syndrome is after injury or after very crushing injury, these muscles release some kind of substances that affect some other organs like kidneys, liver, and some other organs. So it is the crush syndrome. After injury, these muscle cells release some substances that have very negative effect on the other organ. Ischemia, reperfusion. So ischemia is loss of blood supply, and after when we restore blood supply or reperfusion, so it is also secondary trigger. These prolong inflammation and worsen organ dysfunction. Neuroendocrine response. Neuroendocrine response is biphasic response, like it has two phases. One is acute phase that is up to hours, and another is chronic phase that takes days. Acute phase is up to hours. Acute phase leads to increased cortisol, glucagon, adrenaline. So increased cortisol, glucagon, and adrenaline, these are very important for short-term survival. And chronic phase is chronic phase can lead chronic phase is for days. What it does, it leads to decreased hormone levels. Then it leads to chronic wasting. Chronic wasting is loss of muscles pathway. Now we will discuss neuroendocrine response pathway. After injury, when injury happen or some trauma happen, nociceptive neurons are activated in the hypothalamus. So in the hypothalamus, release of CRF take place and pituitary release ACTH that leads to adrenal gland. Then adrenal glands release cortisol. So this is the pathway. After injury, nociceptive neurons are activated. Hypothalamus release CRF, pituitary release ACTH, and adrenal glands release cortisol. So this is neuroendocrine response pathway. Sympathetic nervous system or SNS, it releases two hormones. One is adrenaline and another is glucagon. Its effects are increased glucose release, fat and protein breakdown for energy, altered insulin sensitivity, immune suppression, thyroid and gonadal dysfunction. Cytokines, there are three cytokines: IL-1, IL-6 and TNF alpha. It amplifies stress response. So hyperglycemia, what it does? Hyperglycemia is increased glucose level in the blood. Hyperglycemia worsens inflammation. Now we will discuss about the key medical terms used in our lecture. Homeostasis. What is homeostasis? It is stable internal environment for the cells. Like cells have very stable internal environment for proper functioning, so they maintain it, and this process is known as homeostasis. Catabolic phase. Catabolic phase, it is a breakdown stage after injury, muscle loss, energy conservation. Anabolic phase, it is a repair phase. It is a repair stage or tissue healing. Hypovolemia. What is hypovolemia? It is low blood volume in the body. Lactic acidosis. Lactic acidosis is buildup of lactic acid. When lactic acid is built up, it causes acidic buildup, or when lactic acid is increased in the blood, it is also known as acidic blood. Systemic inflammatory response syndrome, widespread inflammation affecting organs. So it is widespread inflammation that affect multiple organs. MODS, multiple organ dysfunction syndrome, failure of multiple organs. DAMPs, molecules released from damaged cells that trigger inflammation. So DAMPs are basically molecules. These are released from damaged cells or some cells that are damaged or injured. So DAMPs trigger inflammation. PRRs, pattern recognition receptors. Pattern recognition receptors. These are immune sensors that detect DAMPs. Inflammasomes. What are inflammasomes? These are protein complexes that activate inflammation. Cytokines, IL-1, IL-6 and TNF alpha. These are chemical messengers of inflammation. ACTH, adrenocorticotropic hormone. It is a pituitary hormone that stimulates cortisol release. Cortisol, it is stress hormone that mobilizes energy. Glucagon. What is glucagon? Hormone that raises blood sugar. So glucagon basically raises blood sugar. Adrenaline or epinephrine, it is fight or flight hormone. Now we will discuss about the summary. Injury triggers a metabolic stress response involving hormones, cytokines and neural pathways. So cytokines are IL-1, IL-6 and TNF alpha. This response has two phases. Catabolic is breakdown and anabolic is repair response. While protective, it can cause sepsis, immune suppression and multiple organ dysfunction. DAMPs and cytokines drive inflammation while neuroendocrine hormone mobilizes energy. So inflammation is driven by DAMPs and cytokines, and neuroendocrine hormone, these hormones mobilize energy. Modern surgical care or ERAS or critical care, it aims to reduce stress response and improve recovery. Understanding these processes is very crucial for surgeons to manage trauma and surgical patients effectively.